Good afternoon, Newcastle, and welcome to Nctv45. We are moments away from the press conference in Harrisburg, and we're going to go to that in just minutes to give you an idea. We already had spoken with the governor, and I told you about his already conversation that he had with reporters earlier on Newswatch Midday. And so I want to take this opportunity, and we're going to go to Newswatch nightly, and we're going to Harrisburg as soon as they give us the okay that they're on. So hang in there, and we're going to share this and then get to them. I will be checking momentarily, and please hang in there. Let's see. As not up yet and running, but they are coming soon, and so we're going to get to that. Just as everything, the statewide total just shy of 1,400, but when you click the map, and what they'll do is tell you by zip code and where we're at. Lawrence County at 65, as they've upped us one, but they're doing a reevaluation of the numbers. So let's check again, and we'll see if Harrisburg is there. They're not yet, so we will get back to them as time for them to get their stream together as we check in. Numbers, 1,400 increases. Again, they're not telling you where the bump is as far as it looks to be that the age group over 65 has 26%. So that, as this has just come out, and as soon as we see if they're up, and here they go.
Good afternoon, and thank you for joining us today. Here is our latest update on COVID-19 in Pennsylvania. As of 12 a.m. this morning, we have 1,397 new cases of COVID-19. This brings our statewide total to 45,763 Pennsylvanians who have tested positive for COVID-19 in all 67 counties. Approximately 2,753 of our total cases are now in healthcare workers. Approximately 8,112 of our total cases are associated with 468 long-term care living facilities, which include nursing homes and personal care homes and other congregate settings. Tragically, 2,292 patients who have tested positive for COVID-19 have died. And to date, all of our deaths are in adult patients. As of noon today, hospitals are reporting that approximately 2,706 patients are currently hospitalized due to COVID-19. 562 of those patients are currently on a ventilator or a breathing machine. Across our healthcare system, approximately 40% of hospital beds, 40% of our intensive care unit beds, and nearly 70% of our ventilators are still available. We continue to work with our healthcare providers to make sure that they have the PPE, or of our ventilator protective equipment, that they need to care for patients. Each day, we are pushing out this personal protective equipment to frontline responders who have the most critical needs, including nursing homes and personal care homes and other long-term care living facilities. Since the beginning of April, we have made 1,378 shipments of personal protective equipment to nursing and personal care homes. This includes shipments to each of our 695 Department of Health licensed skilled nursing facilities and dozens of other congregate living situations. Since the beginning of this outbreak, we have provided our healthcare workers and first responders with more than 4 million N95 masks, 241,000 hospital gowns, 1.3 million procedure or surgical masks, 1.3 million pairs of gloves, and nearly 80,000 face shields. If you are a business that produces these needed materials and has them available for purchase, please make sure that you are part of our critical medical supplies procurement portal. There is a link on our website at health.pa.gov that connects directly to that portal. As we move to relax social distancing and certain regions and counties go from red to yellow, we need to make sure that our health infrastructure continues to have access to personal protective equipment so that our healthcare providers can protect themselves and protect the public from COVID-19. Now, here are my daily reminders. Please wash your hands with soap and water for at least 20 seconds, or the time that it takes to sing Happy Birthday twice. Use hand sanitizer if soap and water are not available. Cover any coughs or sneezes with your elbow, not with your hands. And don't touch your face, especially after touching surfaces. Clean surfaces frequently. And if you have to go out for life-sustaining activities, please wear a mask if you're going to come into contact with others. These everyday prevention measures can help slow the spread of the dangerous virus COVID-19 and give hope to our families and our communities that we can and we will recover together. If you have questions about your health, please contact your healthcare provider. If you need mental health resources because you or someone you know is experiencing a mental health crisis, please contact the crisis text line by texting PA to 741-741 or call the statewide support and referral helpline at 1-855-284-2494. Again, 1-855-284-2494. For the most reliable information related to Pennsylvania's response, please visit our website at health.pa.gov. And what is most important for Pennsylvanians to remember is stay calm, stay home, and stay safe. And now I'm pleased to answer questions.
Thank you, Secretary. Our first question is from LNP. How did the Health Department develop the metric of no more than 50 cases per 100 100,000 population over a 14-day period?
Well, we're looking for a metric and metrics that will provide information about the change over time, over the last 2 weeks, of cases in counties and then regions. And so that's the metric that we decided that we were going to use. But as I said before, that's not the only consideration. We're going to be looking at other data, and we're going to be looking at other modeling, and we're going to take all of that in consideration as we make our decisions. So some of that will be quantitative, like a metric, and some of it will be qualitative.
From the citizen's voice, when the state is ready to move to the green phase, will bars and restaurants have restrictions imposed on them, or will we be back to business as usual from the beginning?
Well, I have to tell you right now, we are laser focused on certain regions and counties going from red to yellow. So we have not made specific plans for when counties and regions can go to green yet.
From WQKY, since the president has eliminated social distancing guidelines, what will Pennsylvania use moving forward, and will it change based on the 3 phases of opening?
Well, so the stay-at-home orders that the governor has issued remain. Of course, there will be changes, as we've been discussing, when counties and regions are able to go from red to yellow, and then in the future from yellow to green. But nothing generally changes in terms of certainly the red areas in terms of the stay-at-home orders.
Also from WQKY, when an area moves to yellow, what is the signal for all types of businesses to is that a signal, for all types of businesses to resume, or will there be some types of businesses that will remain closed?
Well, we've talked about this. There will be some businesses that will remain closed, especially those where where a large number of people will congregate. So, for instance, movie theaters will stay closed. Restaurants will stay closed in the yellow areas, except for pickup, and large gatherings and concerts will stay closed. But we'll be having more information about life in the yellow zone, so to speak, tomorrow.
From the Carlisle Sentinel, does the department plan on offering testing of asymptomatic residents and staff at nursing homes to prevent outbreaks from occurring at these facilities? What testing options are there for residents at facilities that don't currently have a positive case?
Well, so we are testing individuals that are symptomatic, but they could be mildly symptomatic. And we are working with long-term care living facilities, including nursing homes and personal care homes extensively. So that involves guidance that we have put out and the CMS federal guidance. That involves very frequent phone calls with nursing homes and other facilities with our staff as well as with our contractor, ECRI, where there have been some severe outbreaks. Actually, the National Guard, medical personnel have gone in, and we are doing widespread testing in nursing homes of symptomatic people. Now, if there is someone who is symptomatic, whether a staff member or a resident in a nursing home that hasn't had previous cases, we certainly will test that patient. So it is an absolute priority of the Department of Health and the governor's response.
From Spotlight PA, yesterday we saw an enormous leap in the number of deaths reported. To your knowledge, are there still large numbers of deaths that occurred weeks ago still actively being reconciled in the data systems? And should Pennsylvanians expect to see another spike?
Well, as we talked about yesterday in the last couple of days, we are collecting data from laboratories, from doctors, from hospitals, from county municipal health departments, from state registrars, from coroners, and we work to validate that data. We get data through our NEDS system. We've talked about NEDS, and we get data through our electronic death reporting system. And so one of the challenges has been reconciling all of that data to present the death totals that we're presenting to you. It is possible that as we're going forward, that as we do another reconciliation, that we'll see another increase in terms of the number of cases, and we will explain it that way.
From the Reading Eagle, we believe a Brighton-like situation exists in Berks County at Manor Care Sinking Spring. Is the department engaged with Manor Care about this? And Manor Care West Reading is also seeing a high number of cases and deaths.
Well, we're aware of any situation in a nursing home or personal care home where there are cases of COVID-19 or clusters or outbreaks of COVID-19. So I'm not going to talk about specific facilities, but we are aware of all of those, and we're working intensively with them.
From Spotlight PA, We've spoken with Pennsylvania hospital systems that say they have capacity to do more tests, but are limiting testing to those with coronavirus symptoms. Is the department aware that hospitals have extra capacity, and should they begin testing asymptomatic patients?
At the moment, we're recommending testing symptomatic patients, but we have liberalized our criteria significantly. Previously, we were recommending testing healthcare workers, testing seniors over 65 who had symptoms, and we had some specific criteria. We have liberalized that now to anyone with symptoms. We are aware that our laboratory in Exton, our state laboratory, as well as hospitals and health systems have more capacity. And that is great because we want to expand testing to any symptomatic person, recommend that they contact their healthcare provider, that they arrange for testing at one of those facilities or perhaps at Rite Aid, and that we include that in all of our data. The one place where actually hospitals will be testing asymptomatic people is before elective procedures. So, as we talked about at the beginning of the week, in areas that are not experiencing significant increases in COVID-19, we are letting and encouraging hospitals to do those urgent procedures that have been put on hold for weeks now. And we're recommending that they test those asymptomatic people. By definition, they're asymptomatic because they're going to be having a procedure in several days. And that will actually be very, very useful in terms of our surveillance.
From WLVR, with the reopening of outdoor spaces, what's the health department's guidance for masking in outdoor settings? And how does this apply to people who are doing athletic activities? Are masks effective when they get sweaty or wet?
Masks should be effective if they're somewhat sweaty. If they're completely soaked, then they're less effective. And we recommend that if you're going outdoors, that you wear a mask if you're going to encounter any people. So if you are on a trail or going for a hike or a walk or a bike ride, and you're not going to encounter anyone, then you don't need a mask. But if you're going to be encountering people, that is very important to wear a mask. And again, my mask protects you, and your mask protects me. And if the community is wearing masks, then the whole community is protected.
From WNEP, Pennsylvania continues to include probable cases of COVID-19 in its count of total cases. In the light of yesterday's edition of 479 new deaths, is Pennsylvania still only counting deaths that involve a positive test for COVID-19, or have probable deaths been added back into the total?
Probable deaths have not been added back into the total, and we have no plans to do that in the foreseeable future.
From WNEP, with the help of State Senator Udicek, Northeastern Pennsylvania has created a privately funded program to help nursing homes get the proper PPE. This comes after advocates for seniors and nursing home unions claim the state ignored requests for emergency funds to help deal with the COVID-19 crisis in nursing and personal care homes. Why was the request for additional funds ignored, and what resources are out there for nursing homes that continue to struggle to get the items they need for proper care, such as hand sanitizer?
Well, we as we talked about at the beginning of this press conference, we have pushed out many shipments of personal protective equipment and other measures to nursing homes and other long-term care living facilities. In fact, we had a large push out of N95 masks just this week. And so it's not so much funds that's the issue, it's having the resources that nursing homes and other facilities need to take care of patients. They're not paying for this personal protective equipment that they were pushing out. We have federal funds and other CDC funds, et cetera, for this, that we're pushing out this equipment. We are always pleased to have public-private partnerships to help all of our facilities.
Also from WNEP, a viewer writes, Lycoming County may be one of the first to move to the yellow phase of reopening, but only about 1,200 people have been tested. That's roughly 1% of the county's population. How do you know that Lycoming County falls under that 50 per 100,000 people metric when such a small fraction has been tested for the virus?
Well, we understand that in certain rural areas that less people have been tested and less people have had symptoms. So we are going to follow our metrics and other qualitative factors when counties go from red to yellow. But we are working to expand testing, as we just talked about. Hospitals, including hospitals in Lycoming County, have more testing capability than they had even several weeks ago. So that's great. And if anybody is symptomatic, we want them to contact their healthcare provider. We want them to be tested at those facilities or Rite Aid or other areas testing possibilities that they might have, and then we will be watching really carefully for any outbreaks or any clusters of cases, and we're going to be then using our contact tracers to be able to check on contacts and use appropriate isolation and quarantine to snuff those out.
From Penn Live, some have expressed concern that as testing increases, the number of positive cases will too, and that might skew some counties' chances of getting into the yellow phase. With that in mind, will there be any float on the 50 new cases per 100,000 residents to account for growth in testing?
Well, we're not going to change our metric, but we're going to be testing pretty uniformly across the symptomatic patients across the yellow zones. So and even in terms of red zones. So I don't think it's going to really skew anything. And again, that metric is just one piece of the puzzle. In some ways, what I might say is the metric is necessary, but it's not sufficient. We're looking at other different qualitative factors to decide which counties will go from red to yellow.
Also from Penn Live, asking about the 50 cases per 100,000. We know it's not the only thing, but is it a mandatory prerequisite?
I would say that it is necessary. We'll always be taking other qualitative factors into consideration, but if we see a county which has significantly more than 50 per 100,000, it's much less likely to go to yellow.
From WKOK, is remdesivir a game changer in the battle against COVID-19? Explain what it does more effectively than any other remedy to date.
So this medication was developed for treatment of Ebola after 2014 and the Ebola outbreak in West Africa. And so it's an antiviral. Ebola is a virus, completely different type of virus, but it has been tested on patients with COVID-19. And there is a study now that shows that it can be effective in patients. A game changer would be probably not what I would say, but I think it's very promising. Of course, in science and in medicine, more studies need to be done to see how effective it is, which patients should be used, what dose should be used, how long it should be used for. All of that still needs to be determined, but it's very promising.
Also from WKOK, is there a resurgence of COVID? If there is a resurgence of COVID-19 in the fall, in what ways might you prepare differently based on the lessons learned this spring?
Well, one of the challenges this spring, which we've discussed before, were the great difficulty we had in terms of getting testing from the CDC and the federal government in February and then into the beginning of March. And so we are expanding testing, as we've talked about. We have more capacity at our laboratory. The hospitals and health systems have more capacity. Commercial laboratories have more capacity. We had a great phone call with the federal government a day or so ago with the Assistant Secretary of Health, Admiral Giroir, from Health and Human Services, as well as the CDC and the FDA, about all the different components of testing, the swabs, the media for the virals, the test tubes, for the platforms for testing and for extraction, all the different aspects of that. And they gave us a lot of information. They're going to be shipping to us swabs and the test media. They have provided a lot of information about how we're going to be able to access the other materials for testing. And so we're very pleased that testing is becoming more available, and we're going to be using that testing as we roll out our schema going from red to yellow. in the fall, we're hoping that even more testing is available. And, we've been discussing this with the governor on a regular basis. From an aspirational point of view, if we have much more testing, how would we use that to deal with or hopefully prevent a surge of increased cases in the fall? And we're developing those plans now.
From the Free Press, we're seeing a lot of misinformation about the reopening of the state being shared on social media platforms such as Facebook. One post in particular shares official-looking documents from a conceptual plan linked to a state representative and lists 40 counties as opening on Monday, May 4th. People continue to believe and share this information, believing it is fact. Others believe everything reopens on May 8th and their lives will automatically return to normal. Do you have any advice on how to effectively share the correct information when so much misinformation is already out there?
It is challenging, and we know that social media can be very difficult in terms of the truth of the information that it's sharing. So you can go to our website at health.pa.gov and get the accurate information.
From PA Post and WITF, during the state government committee hearing today, one of the election directors testified that counties are calling on Governor Wolf to issue an order regarding polling places needing to be open for the primary on June 2nd, so long as there isn't a public health concern preventing it. For example, nursing homes that normally serve as voting locations should remain off limits, while schools should be available for voting as usual. Is that something the governor is planning and or willing and or able to do?
Actually, I'm going to refer any questions about the election and polling places to the governor.
From News Talk 104.1, there is an outbreak of cases in 2 Lycoming County nursing homes. Is the guidance to treat in place or move to isolation rooms at a hospital?
Well, so it depends on what the patient needs. So if patients are in long-term care living facilities and they're not very ill, they might have a fever and a cough, but they're not critically ill, then they will be treated at that long-term care living facility and they will remain in isolation. If there are a number of different patients, then we want them to cohort the patients and cohort the staff, and we are making sure that they have the personal protective equipment and other resources that they need. We'll be providing infection control consultations, and then we can work with ECRI, our consultant, to do that as well. If a patient is severely ill, of course, then they should be transported to the hospital for further intensive medical care.
From the Williamsport Sun-Gazette, many of our readers ask about the statistics of recovered patients, ones that would not be considered contagious anymore. Is the department tracking or compiling data of those that have recovered by county?
Well, we've talked about this. So we have over 45,000 Pennsylvanians who've contracted COVID-19, and it really isn't possible for us to contact them to see it when they recovered. Now, you can do the math in terms of the numbers of patients, and you can go back over our statistics about go 14 days, and they should be better. But we don't know that. And we want to make sure that we give you validated information on a regular basis, so we're not making any type of guesses. And so we're not able to provide that information about recovered patients.
From the Pittsburgh Post-Gazette, why did the state appoint a manager to run the Brighton rehab facility? Did the owners ask first, or did the state said it was going to support one?
This was a very collaborative decision in terms of appointing a temporary manager.
From WTAE, also on this topic, yesterday Dr. Levine said the state is stepping in to help the nursing home in Beaver County. We understand this to be specifically Brighton Rehab and Wellness. By adding a temporary manager and contracting a consultant to focus on infection control, have those steps been taken, and what more is being done to ensure the safety of the residents? Well,
those steps have been taken, and we are doing everything possible to try to ensure the safety of the residents and the staff.
You also mentioned hosting daily calls with staff. What did we learn with today's call?
I don't have that granular detail.
From the Philadelphia Inquirer, how are healthcare providers and medical facilities following the department's mandate of including race and ethnicity data in their tests?
So it's very important, and I and the governor have called upon facilities and laboratories to include all of that data, including race and ethnicity, when they are doing laboratory testing and then report those results to us. We are doing better in terms of facilities and laboratories reporting that data, but we're not there yet.
Have you had to enforce that reporting, and if so, how?
Well, it's hard to enforce it with them. We're calling upon them to do it, both through our press conferences, but then other communication, and we feel that they will comply and that our data reporting will get better. We have done this in the past when we were reporting lead data. It takes a while, but we think we'll be successful.
From the Pittsburgh Post-Gazette, a follow-up question on the Brighton nursing home. What is the goal of the temporary manager? Is it to bring Brighton Rehab into compliance or help it wind down operations and close?
The temporary manager is there to help us and help the staff there in terms of their taking care of patients and preventing further patients from getting COVID-19 and taking care of the patients that do.
From News Talk 104.1, the Secretary of Health in Illinois said recently that existing hospice cases who contract COVID-19 are being classified as a COVID death. Is Pennsylvania doing the same thing? And if so, is it fair to say that COVID-19 was not the primary cause of death, and will the numbers be updated accordingly?
I actually do not know the answer to that question, so we'll have to look into that for you and get back to you.
From the Philadelphia Inquirer, you mentioned working with hospitals, counties, and municipalities to bolster state contact tracing staff. Will you be hiring lay people? And if people are interested in helping with contact tracing, can they do so, or how can they sign up?
So we are looking to hire people to help us in terms of contact tracing. We're going to have more specific information about that soon.
Also from the Philadelphia Inquirer regarding the state loans to hospitals announced today, what impact do you see this money having on health systems, and how quickly? Do you think it'll be enough to keep them afloat, or could there be more state funds needed?
Well, I think that it's going to be extremely helpful for the hospitals that have signed up for that loan program. Of course, the federal money is also coming to hospitals and health systems that will help keep them afloat. And then many of them are going to be starting to have elective procedures and operations, which is a large part of their revenue. And so we want to do everything we can to help our very important hospitals and health systems stay afloat and take care of patients.
From WFMZ, do you have a time frame when test kits will be available for nursing home staff and residents?
Well, we do provide testing for nursing home staff and residents. When you say test kits, I mean, the testing is not being done in the facility. The samples are being obtained, and then the samples are being run either at our facility in Exton, or they're sent to hospital laboratories or commercial laboratories. We do that now.
From the Capital Star, has the department traced any COVID-19 cases back to the March special elections in Philadelphia, Westmoreland, and Mercer counties?
I don't know the answer to that question.
From the Tribune Democrat, State Representative Frank Burns is calling on Governor Wolf to allow all businesses, regardless of size, to offer curbside pickup and delivery following established safety protocols. If state wine and spirit stores can operate safely, won't this work for retail businesses?
Well, we are going with the schema that the governor has outlined, where counties and regions will go from red, which is the shutdown that we have now, to yellow, where many businesses will be able to do curbside or open following social distancing, and then eventually to green. So that's the schema that we'll be following.
From ABC 27, how often will the state be announcing updates about counties going from red to yellow, daily or weekly?
We haven't exactly determined yet, but we'll be announcing it when those decisions are made about further counties going from red to yellow.
From WJAC, at what time and manner tomorrow does the state plan to release the counties or regions that will be allowed to move to the yellow phase on May 8th?
Well, I don't know the exact time. Many of our press releases are at 12, and then we have press conferences at 2. That would probably be my estimate, but I have not been in communication with the governor's communications office about what time that will be released tomorrow.
From WBRE, With the announcement of openings tomorrow, what steps is the department taking to make those openings as safe and effective as possible? Could you elaborate on the parts of the process that deemed these businesses ready to be open during this time?
Well, we're working in terms of the ability to do social distancing, either through curbside business or for no more than 25 people to be in a business, being 6 feet apart, etc., and making sure that that all of our other guidelines are able to be followed. And then we'll be making those announcements tomorrow for the counties on May 8th that will go from red to yellow.
Our last question is from WITF. We're about a week away from the governor's gradual reopening of business. Widespread testing and contact tracing are seen as essential to a safe reopening. Are you concerned that we don't have that widespread testing and contact tracing in place?
No, we have very extensive testing and contact tracing plans. We're going to be releasing them. It'll either be tomorrow or over the weekend and Monday, so that the public knows exactly what those plans are. So we're very confident in our plan.
Thank you, Secretary. For any reporters whose questions we were not able to get to today, our press office will respond within the next 24 hours. Our next press briefing will be tomorrow.
Okay, we're back, and just a few things before we go to shoot down. We brought out the 14 days, issued that to the governor, and we did not receive back any information. Lawrence County Commissioner Morgan Boyd was optimistic about Lawrence County's prospects of going to yellow at the close to May 8th. Wolf said Northwest Pennsylvania is a region they're looking at, and the governor classifies Lawrence as being in that region, which means Northwest. No joke. As we continue on giving you information, and I wanted to hit all of these topics because they just came out, and I'm not going to go to anything else. This is going to conclude our news watch for the day. The Department of Community and Economic Development pursues the homeless campaign, encouraging travelers to visit Pennsylvania from the comfort of their home. That went because this is tourism week, and we told you, I don't know how that came out of Lawrence County Travel and Tourism, but they put that press release forward. As we continue on with Newswatch, and I want to get out of this, Tina. Yeah, and Tina's skeptical of what they're saying, and I'm just going to leave that post out there. I agree, because when you do the numbers, now, here's what it's saying, and really think about this. Today they announced 65 cases. We got one new case today on that. That's the 30th. But we had gone through from the 16th only picking up 3 cases. And I'll go back and check to see if we picked up one Friday. We've got 3 to 4 cases in this county based on the 14-day. That's what she said on TV. That's the question Nctv45 put to her and the governor. That's the question that was put to them, and they didn't want to answer it. No response from anybody. And yes, in my humble opinion, the cure has now gotten worse than the disease. PA dental offices also need to, with PPE supplies. Will Governor Wolf please help get the supplies? According to what was said in his press, he had a private press conference, Tina. And he alluded to trying to work with dental offices to open that. Let me tell you how this works. I'm an ulcerative colitis patient. It's being treated with an immune deficiency disorder. So they come in, and when they give me my Nctv, they have a thing that goes like this to take my temperature. They ask any questions, no fever, no sore throat, drink this water. Okay, it doesn't look like you're having any problems. And then, boom, they give me the Nctv. I would say that he's going to have dental offices check and test before they do anything. So that's what I put together from his press conference at 12. That was a closed press conference. And other than that, can't really comment on anything else that they were saying. Department of Labor and Industry, they're getting there 3 or 4 weeks behind, and they hope to catch up at some point in time. 1,400 cases, 1,397 today, 45,763. When you take the 14 days, and there were 30,000, and I believe I did that number on the 10th of the month. Here it is. And I want to read the comment that he made on masks too. The 30,000 was on the 10th of the month. If you take that off of there, there's 15,000 cases in Pennsylvania, or less. If you take the number in Philadelphia, it really starts to look a little bit screwy. He's requiring masks as self-enforcement. He's asking businesses to put up signs telling people to wear masks. But any perspiration, rain, sweat, moisture, the Secretary of Health said the mask is non-effective. So understand that as you move forward too. Well, that's going to do it for Newswatch Nightly. I encourage you to tune into the weather right now, 59 and raining in Newcastle, and you're going to get that again tomorrow. Now, make sure you tell a friend and have a friend tell a friend about Nctv45. They'll be glad you did. And when they say, I don't watch a lot of TV, you tell them that Nctv45 is available anytime on your time. Here's a train that runs on your schedule. It's Nctv45. Make sure you get that second cup of coffee, iced tea, whatever it may be, and have a super day in what I call the greatest castle in the world, in the county of Lawrence. Have a great day, everybody. We'll see you again real soon.
You know what I mean, just the two of us.